How's it going, man? Welcome, episode 8. We're going to be talking about emergency protocols. And here at the Dental Advocate today, we got a real good guest for you guys. I'm excited about today. I've been talking about this guy for a while. This is Orlando Sanchez, a good friend of mine. He's been doing this 25 years, is it?
Just about 25,
Yeah.
26 years.
25 years, man. He's an RDA and he's a back office regional manager for specialty services. So today we're just gonna get down and talk about a couple of things that maybe we don't really think about on a day-to-day basis because it doesn't happen every day. But Orlando's gonna shed a little bit of light on that for us. And so what are some of the things that you see happen in an office as a specialty assistant when there's an emergency?
Well, first of all, thanks for having me on the show, Trini. Much appreciated, man.
Hey, you're welcome, man.
You know, and thanks for coming up with this topic because it is one important topic that it gets overseen a lot. Emergencies, we never know when we're going to run into emergencies.
Yeah.
And basically, that's the last thing that's on our minds when we're trying to take care of our patients in the dental office.
And honestly, like, on a day-to-day basis, to me, like, the worst emergency is, like, maybe a patient will throw up or, like, they feel lightheaded or they say they're nervous and they're sweating. And I don't necessarily get, like, a red flag, but it may also be stemming from something else that they may have, going on.
I'll be honest with you. You know, a patient throwing up on you is actually a good day. It's actually not that bad if a patient throws up on you. So, yeah, be careful, man. I got a full stomach, so I might even throw up on you right now. You know, but it's not that bad.
My day.
Yeah, there you go. What is concerning is, if a patient feels cold and starts to sweat, how do we react to that? And a lot of times the assistants don't know what to do. They're just like, oh, you'll be okay. Just kind of hang tight, take a couple deep breaths, or I'll be right back. Let me go get the doctor.
Or, honestly, I've even heard assistants say, hey, you want some water? You want me to sit you up? I mean, I don't think we feel like it's a true emergency until we physically or, visually see something that
there's a lot of ways to react to a patient that is feeling cold and starting to sweat, okay? Because if the patient's an elderly, then that could be a sign of a stroke, heart attack. So it can go into many different ways. If you have a young kid or a middle-aged adult, sometimes the epinephrine can cause a reaction to where it causes them to feel that way. How do we react? What do we do?
Yeah, we have had patients when they come in and, sometimes they even tell us, they say, hey, I must be feeling a little nervous. I'm not sure, but my heart's going. And we just give them the injection. And we'll explain to them, yeah, well, we just give an injection and it contains epinephrine, gets your heart going a little bit, should go away.
So if it's a morning patient, and that happens to me, first thing I ask, did you eat breakfast? Because the system goes crazy. The system goes crazy. Their stomach is empty. They're going to end up throwing up on you. They may end up passing out. So you always want to ask that question, did you have anything to eat? Especially if you're doing long procedures. Mm-hmm. If you're doing long procedures, a crown prep, an extraction, you want to make sure that they did eat. Because on a bridge or an extraction, you need to numb the heck out of that. Okay, you need to numb them up really good. How long are they going to be numb for?
Yeah.
Your doctor needs that site to be numb for a good hour or so, depending on your doctor.
Yeah.
Okay, some doctors can prep that tooth in, 5-10 minutes. Some other doctors will prep in 30, 45 minutes to an hour, and that's just one tooth.
It depends, I think, on the procedure too. Sometimes during the preparation, you need them to be numb, and then you got things going on between, and then more at the end, you also need them to be numb, and sometimes you have to add.
So the basic thing to know about your patient is always know if there's any medications that they're taking. Diabetic, blood pressure. Blood pressure is the biggest thing. Diabetic is the biggest thing. those are the patients you want to see early in the day, because the longer they go, if let's say they don't eat breakfast, that's their highest risk right there. If they have not eaten breakfast, it's getting close to lunch, they're on their break, they came from work, and it's just like, no, I didn't have
Yeah.
time this morning.
Yeah. And I wonder how many offices don't check blood pressure, because I know that I've been in some offices where I think once in a while we checked it, and that was if the assistant paid attention to the health history. I mean, most of the doctors that I work with are pretty good at checking the health history, but I'd have to say that I feel like the assistants also feel like it's the doctor's job, you know?
As an assistant that's been in the field for many years, we make the doctor successful, okay? Because we make their job a lot smoother for them.
Mm-hmm.
We're the middle person, because the patient needs to trust us. They trust in
I
us,
totally agree with you on that.
because if we don't feel comfortable, then why are we there?
Yeah.
Why are we there if we don't feel comfortable with certain things? We're there because we enjoy working with these doctors. We take pride in what they do, how they do it, how they care for their patients.
Mm-hmm.
Otherwise, we wouldn't be in that office.
Yeah,
Okay?
I agree with you.
So, us looking out for our patients is a big deal,
Yeah.
because we don't need them, one, passing out in our chair. Two, we don't need them throwing up on our nice scrubs. Those scrubs are expensive nowadays.
On the
Oh, no.
pigs.
Yeah, I'm not shopping at Swami for my scrubs anymore, man. I got catalog orders coming through, so I'm spending a good $80 on my
Hey,
scrubs.
I still gotta get my figs, man.
I don't know about the fig tops. They look a little tight on my stomach, but
I'm okay with that.
you're okay. So it's just how much does get overlooked? How much gets overlooked while we're in the office?
I know that in specialty, there's a big part of that is the assistant coming in and looking at all that stuff. But honestly, there's not very many general doctors that ask their assistants, "Did you look at the health history?" You know what I mean? So I think, when we were talking earlier, you were telling me a couple things, and I was just thinking, but my doctor's never asked me that. And I'm not saying my doctor, the doctor I have now. I mean, I've been doing this 23 years, so it's I don't remember any doctor holding me accountable for letting them know what is on the health history. I think I feel like the industry has kind of laid that on them, but I at one point I was working where the assistants had to know.
Yeah.
They hands down, they had to know. Doctor B, anything they're allergic to anything, and you had to know. If you didn't know, that was not, and it wasn't cool. So you had to know.
It's important. It's important. That's one of the basic things that you strike a conversation with your patient. Okay. You bring them back from the waiting room into the operatory, and you're gonna have a conversation. How you doing today? How's the day? You coming from work? Your day off? Once you get them to that chair, you start asking those questions before you even bring the doctor in. Do you have high blood pressure, cholesterol, diabetes? Do you smoke? Because that goes in conjunction with a lot of what the treatment's gonna, consist of.
Yeah.
If they're there for an extraction and they're diabetic and they haven't eaten, that's gonna be a big problem.
Yeah.
How do now? Let's say we didn't ask that. We didn't ask any questions. Just seated the patient, and doctor comes in and says, "Okay, are you ready?" Bam, starts numbing up. All of a sudden, your patient starts to shake. At that point, as an assistant, what are you going to do? You're going to just sit there and look at the doctor like, are you going to do something? Because I don't know what's going on. And that's what a lot of assistants see right now.
Yeah, yeah, definitely.
A lot of the assistants see this right now. And, patients like shaking and they're cold, they're sweating, and they're waiting for the doctor to say something. And at that point, what do you do as an assistant if your patient's shaking? Well, first you got to, assess your patient. How's
Yeah.
their color? The first thing I see when I walk you back into the operatory is I look at the color of your skin, your skin tone. Because if something changes in the room,
Oh, I
I
see.
know you're not feeling good. If you're white as a ghost, I know something's up.
Yeah.
If your lips are getting chapped, I know something's up. And these are small signs that can be very crucial during the treatment because at any time that patient can just flip on you. They
Yeah.
can flip on you. Sometimes a bright light onto younger kids. I've seen this on young males where you turn that light on and all of a sudden they start to have a seizure. And it's like, well, what's going on? You go bring the parent back and it's like, oh, well, they're sensitive to bright lights or flashing lights. And well, it's not noted anywhere. So how are we supposed to know
Yeah.
this?
Yeah.
So, the more you talk to a patient, assess them, get to know them before you do anything. Yes,
Yeah.
it's going to take 3 minutes to do this. It may take 5 minutes. A 10-minute conversation goes a long way because a 10-minute conversation can save you a lawsuit, can save the office a lawsuit, save your doctor, save your
and
patient.
and, and it's I agree with you, and it's also about having your doctors back in that sense to back them up on that as a safety net. I mean, obviously, you know, I would have to say that most doctors, and I hope all, check the health history, but your assistant checking it, that's a good safety net.
It's a
And
huge, huge safety net because your assistant, if they see you numbing up with epinephrine and that patient
mm-hmm.
can't have epi, it's like, hey, doc, can't do
Yeah,
that. You just give that little sign
yeah,
like,
yeah,
give me 1 minute. And
yeah,
that's all you have to say is just give me 1 minute. The doctor's gonna turn around, look at you, and you kind of develop to where they start to learn your
yeah, yeah,
signs,
yeah, yeah,
and
yeah.
you take that syringe, you flip, you switch out that carpio. Of course, you got to toss it in the pharmaceuticals. Um, don't put it back in the drawer. Don't throw it in the trash.
Save it for the next patient.
Yeah, no, you can't do that. But it's those little signs. A lot of times, it's just that simple thing.
Yeah, yeah.
Afterwards, your doctor's gonna come out and be like, "Oh, good catch, good catch."
Well, I'm definitely gonna watch out for a lot for the health histories. I'll be honest with you. I check them sometimes when I know or I feel like something might be wrong, but it's not. Yeah, I know my doctor checks them. Like even before she sees the patients, she interviews them and she checks it. I know she does, but I think it's a great thing to do. When you're an assistant and you're first starting out, to get a good habit of that, so that you can be your doctor's safety net, and that you become more valuable because they know that you have their back, and they're always going to be like, hey, I want Orlando to assist me, or I want Trinidad to assist me because I know he has my back. You know what I mean?
And we're looking out for the patient.
Yeah.
We're looking out for the patient, looking out for the doctor. We're there to care for our patients
Yeah.
majority of the time, and just basically making it easier for the
Yeah.
doctors.
And I will bet you that even there are some doctors that I have seen, and I'm sure it's happened in other offices where something's going on with the patient, and the doctor turns right around and out the door and goes and gets the manager, like if the manager's gonna do something.
I need you to go do CPR on that patient real quick. They're on the floor. I don't know what to do, but
Yeah.
it's like,
Or
what's the manager gonna do?
I think the first thing a lot of us do, if we're not trained or we don't practice, or we just go get the oxygen tank, or go get the emergency medical kit. But honestly, I wouldn't even know.
A lot of times, the general assistant doesn't know how to turn on an oxygen tank. A lot of times, the general assistant doesn't know where the emergency box is at. I mean, do you know what's inside of an emergency box? I'm sure you can tell me 5 things that are in that emergency box.
Uh, I know there's. Is it nitroglycerin?
Nitroglycerin.
All right.
Okay.
There's some aspirin.
There's aspirin.
There's epinephrine.
There's epinephrine in a really nice sized needle that you just jab
Yeah.
into your patient.
Yep. That's the.
Literally, you have to jab it into your patient.
Yeah.
It's not as simple. Just here you go. No.
And then there's the sweet stuff, the sugar that you put under
Yeah.
the tongue.
Majority of the times now they're putting the frosting. It's like cake frosting because it's like super sweet.
But you put it under the tongue, right?
Yeah, you just squirt it in there. It doesn't matter where it goes. You just squirt it in there. Here.
Right. Some for
Take
me,
it in.
some for you.
Yep.
Some for me, some for you.
Yep. And you know, one of the most important things in that box is Benadryl.
Yeah.
You know, because a lot of times your patients are going to have some sort of a reaction to, I don't know, latex gloves.
Yeah.
You know, ever since I don't know, they've done so many studies, and latex gloves have actually been taken off of a lot of dental office, and we're now into nitrile. You know, for a lot of sensitive people.
I have seen that some offices, even if they're not allergic, they just use all nitrile.
Yeah.
Yeah.
Yeah. And the latex gloves are basically by request by the doctor.
Yeah.
You know, majority of the time they're by request. One of the other things that assistants don't understand either is when they're administering nitrous on these patients. Okay, let's turn it on. All right, we're done. Let's walk out, let them breathe for about 5 minutes. What happens in 5 minutes when your patient's on nitrous?
So let me ask you. We do nitrous at the office. We don't leave our patients alone, but I have witnessed that where, you know, patients get left alone in the operatory. And what are some of the things to look out for to when someone's on nitrous? What do you? I mean, obviously you want to check to see if they're breathing, but what are some of the things you can tell them that they may feel or that
they're going to feel really heavy? They're going to feel that their hands are super heavy and they're just like on clouds. They're like I feel dizzy. I feel lightheaded. I feel like I'm going to fall asleep. Honestly, I don't know many assistants that can say, okay, let me turn the nitrous down a little bit. I'm going to go get the doctor. Stay in the room. Always stay in the room and just, hey, doc, I need you in room 3. You know, and if they don't hear you, doc, I need you in room 3. If they don't hear you again, can I get the doctor in room 3? It doesn't matter if you have more patients in the room because technically we're not supposed to administer nitrous without a doctor present in the operatory.
Yeah, that I'm very aware of.
I've worked with several oral surgeons where we've used nitrous to actually sedate a patient. A good 3 minutes, and you know, working in specialty, it's a huge difference versus working in GP. A lot of the oral surgeons are trained to work certain ways to where a GP, a general practitioner, will administer and just let them breathe the nitrous for a good 20-30 minutes before they even start a procedure. Technically, it only takes 3 minutes, 5 max, to get a patient to a real comfortable stage before they kind of go into that in-between where they're feeling really good and they're like, okay, I'm ready to do this. I feel like I just had 2-3 drinks and I'm good to go.
So let me ask you a question. Well, as far as the levels and the ratios, what are some of the ratios you've seen, or different ratios that you've seen surgeons or any doctor use when they first start off on putting nitrous on a patient?
So we typically start our patients at about 2 to 3 liters of oxygen. Okay, we run them on oxygen for about 5 minutes, get their lungs filled in with some pure oxygen. Then we're going to bump it up to about 4 to 5 liters as we bring that nitrous up as well. You can't start them off right away.
Now, when you say liters, you're talking about those numbers that are on that. Those are liters.
Yes.
Okay.
Okay, and you don't always want to crank it up to 10. Some doctors feel that, oh, let's just crank it up all the way. It doesn't work because all of that air has to go somewhere, and it's not going into the lungs because your patient can only breathe in so much.
Yeah.
Uh,
So then we all
it's
feel
like,
good.
whew, we got a blueberry from what is it? I forget Willy Wonka.
Willy
We turned
Wonka.
into a blueberry.
Yeah, yeah. Oh, that's right. I
Yeah,
just saw it.
yeah. We're not gonna turn into nothing like that. But you can only push so much into the lungs that 4 or 5 liters of oxygen in with a good 2 3 liters of nitrous, as long as the patient's taking nice breaths,
Mm-hmm.
you're good. But what do as a GP assistant, what are you going to do if your patient's eyes start to roll? I mean, majority of them don't think about it. Maybe I should turn the nitrous off.
But isn't nitrous pretty safe? I mean, why would I mean, what can go wrong with nitrous?
Did you grow up in the 80s? You partied in the 90s, right?
Yeah.
Okay. So, an example here. You remember the house parties?
Yeah.
Okay, Street Beat magazine, always at those parties. Well, what was going on at these parties? You remember the balloons?
Yep, that was it.
What was in the balloons?
Yeah, nitrous.
Nitrous. How many kids did you see on the news that were dead in the back of a truck from a nitrous tank laying next to them?
Oh, that's crazy.
Nitrous can be very harmful if it's not utilized properly by, the right people. A lot of things can go wrong with nitrous. You have to mix it up. It's not something that you could play with, and that's kids didn't understand that's what happened when the 90s hit and nitrous was a thing. And now it's a lot of other stuff.
Yeah,
for some
sure.
of those girls, I don't even know what they're popping. Who's Molly? I don't know.
Who's
Molly? But nitrous, it's just we need to really pay attention as assistants as far as how to care for the patient. Look for the patient's best interest majority of the time.
Yeah.
What can we do? What signs do we look for? As an assistant, when you go back tomorrow to your office, just pay attention to your patients a little bit more. Take the time to just kind of go over a medical history, diabetics. It's real important because we all need to be educated on a daily basis. I work with many surgeons, many great assistants. I have a great surgical team of about 92 assistants. Majority of them are really good and can react to any emergency. So
yeah, I gotta say, I've never been in any of the specialties. I've helped, but not consistently or actually joined a specialty team. So that I do know that I've missed out on being more aware on stuff like that, because I just feel like the training is different. Obviously,
training is a lot different, but look at it this way: you can build a huge empire of buildings on how you make your crowns, and you're an artist. You've taken pride in that, and surgical staff members take pride in certain categories of the dental field, and specialty is not for everyone, but an emergency, that's for everyone. It can happen anywhere you go. I've helped many people outside of a dental office, just watching them. One day I was walking with my wife, and we seen this kid on the side, and he was throwing up. He felt very, very cold, sweaty. He was very pale. He was very weak. And luckily my wife, she always carries candy for me because I'm a huge candy freak. And, once in a while I feel a little lightheaded myself to where I need some sugar, and I'm not diabetic. But this kid, we actually had him sit down, gave him a couple pieces of candy, and we didn't leave him until after he felt okay.
Yeah.
You just never know. You can be walking anywhere and somebody just needs that extra push.
Yeah. You're totally right, because I know that I've gone to places where I felt like something might go wrong, like some huge party and everyone's wilding out or something, and then you're just like, shit, something's going to go wrong here. Someone's going to freaking flop down on the floor face first, and what the heck are we going to do, So, yeah, I think most of the time, if there was something going on, I personally can help, but I wouldn't be the first person to help because I wouldn't really know what to do.
Yeah. One of the things that my staff does on a daily basis is they always run protocols. They run protocols first thing in the morning. They check all their emergency equipment. They make sure that they have enough oxygen for whatever goes on with the patient. Of course, they need to treat patients, but you got to have that backup. If you don't
Yeah.
have that backup, how are you going to help your patients if they need oxygen and you're all out, you know?
Mm-hmm.
But majority of my surgical staff do interview a patient. They spend a good 15-20 minutes interviewing a patient. Yeah, we might fall behind for a good 5-10 minutes or so, sometimes an hour and a half, but they took the time to to ask those
Yeah.
questions and relay it to the doctor. And
So
go ahead.
so let me ask you a question. Um, there's been offices that call the ambulance, and they get there and they assess everything, and most of the time they're cool. Like, they obviously they're helping, it's their job, but I have seen where they come in and they're annoyed. They're annoyed because
Like the
they,
paramedics are annoyed.
yeah, one
That's their
guy,
job.
like one guy might be no, well, no, I'm not saying they're annoyed because they had to be there. They're annoyed because they're disappointed with the assessment that was made by the office. You know what I mean? Because I think it could have been like something simple, and maybe didn't have to call them. I mean, obviously you want to be safe and be rather safe than sorry. I understand that, but what I was gonna ask you is, so at what point do you call them? And I mean, obviously someone's having a heart attack. I mean, I know the obvious reasons, but how can you tell if this is gonna be someone that's gonna go in
See,
the ambulance?
that's a tough call.
Yeah.
There's some contradiction there where your lead assistant sometimes feels that they're telling the doctor like, "Hey, we need to call 911 or we need to call an ambulance." Sometimes the doctor will be like, "You know what? We need to make that call."
Yeah.
At that point, when the doctor says make that call, it's severe.
Mm.
If your surgeon is saying,
Mm-hmm.
call 911. Some assistants have made that call. Ambulance is walking in, and the doctor's finishing up treatment on the patient they called for. And at that point, it's like, well, why did you do that? You just costed the office $500-600.
Mm-hmm.
But ultimately, it's up to the doctor. It's up to
Yeah.
the doctor, unless that patient's going into convulsions and your doctor's focusing on the patient, and your doctor, and he may have flagged you in a certain way, and that's just code. That's just code
Yeah.
of a
Yeah.
routine. Every time that they go over stuff, it's like, if I give you this signal, or if I say something, that means go take care of
Yeah.
what we got to take care of. But majority of the time, it's the doctor's call,
Yeah.
and it's a difficult thing to do because you don't know. You don't know if that patient's okay,
Yeah.
or if they're really having a panic
Yeah.
attack. Anybody can have a panic attack. I mean, shoot, I was nervous coming to see you today, man. I had a panic attack just driving over here.
I in some of the offices I've been in, we've called the ambulance and everything, eventually is okay. And but I gotta say, those moments I can clearly recall them, and yeah, I panicked. I panicked, and I'm sure you know how important it is to stay calm. To staying calm,
The
and
key thing is to stay calm, because when you panic, that's when you make mistakes.
yeah,
Most mistakes happen when everybody starts to panic. And the minute one panics, the next one panics. And then after that, you got your doctor just all wound up, like telling you, just shut up.
yeah,
But I've been in a situation about 15 years ago. I was in a situation. It seemed like we were in the operatory for a good 2 hours.
Mhm.
In reality, it was only a 4 minute
Wow.
interval, and it was scary. Patient was taken in an ambulance. Everything was fine. Everything was fine, but you just never know.
Yeah.
You just never know. We asked all the proper questions. We all stayed very calm. The doctor maintained. He knew exactly what to do. And the team that I was with at the time we all knew what was expected from us.
Mhm.
At that time, I was in charge of our med box, emergency med
Mhm.
box, so I knew
And
my sign is bring the box in.
and I remember I can't remember exactly what year, but now all the offices that I'm familiar with have the box where you know
An AED.
an AED.
Yeah.
And I mean, you never saw one in office before.
No.
And when those started rolling in, I thought, what do we like? I felt like, whoa, this is serious, like we really have to learn how to do this. But it's pretty self-explanatory once you turn it on. But
Yeah.
still, I was just kind of like, wow, like this is serious if we ever had to do that.
Well, I mean, you can find AED at the mall now too.
Yeah.
By the
Yeah.
bathroom. I don't know who's going to run to the bathroom when they have an emergency. That's a different emergency, but yeah.
Ate a big old burrito.
But one of the things to do is take 5 minutes in the morning. Take 5 minutes in the morning, assess your team, as long as all your team is there and nobody's running out to get coffee or whatever, and just make sure everybody knows where everything's at. Because you never know if that new person who just walked into your office, do they know where the emergency tank is at? That's one of the first things that I do whenever I bring someone new into the office. I always let them know these are the steps that you need to take as you walk back to put your stuff into an operatory. Walk through the office. Make sure you know where everything is at. Eye wash station, emergency, AED, extinguisher. Hopefully we never need an extinguisher, AED, or any of that. But also always know where your emergency box is at. Oral surgeons carry their own emergencies, but the office also has them.
Yeah.
Make sure that your staff knows exactly what is in that box, because that is going to save someone's life.
Yeah, I'll do that for sure. I'm familiar with most of it because I actually most of the time that I've been assisting, I've been lead, and I have to order that stuff. Now it's automatic. It just comes in and you replace it. But before, I would actually sit there and read it and figure it out and all that. You know what I mean?
Yeah.
So definitely, I'm gonna review that stuff and make sure that
emergency protocols are important.
See if we can get some.
I think we might have to come back for a recap on everything.
All right, I think we got some questions here, Orlando. Let's see. I'm trying to lower my. All right, here we go. All right, so it says, how often do these types of emergency happen? Weekly, monthly? And that's from Denise. Thank you, Denise.
Emergencies, it can happen on a daily basis. It happens everywhere. I would say an emergency every 2 minutes, maybe 1 minute. They say a baby's born every 15 seconds. So how often is an emergency happening in a dental office?
Yeah. We got Natalie watching. Oh, Maria Ponce is watching.
Hi, Maria.
We got a groupie. What's up, Maria? She's gonna hate me for that one.
She hates everybody. It's okay.
She hates everybody.
Yeah. We're her favorites, though.
All right.
So we're good.
We're the most favorite hated. So, when you're in the office and you come in, and I know OS, most of the time they put people to sleep, and I know you guys do a lot of that in the morning, because I think they can't eat anything before they come in, right?
For at least 6 to 8 hours, depending on the doctor.
Yeah. So, can you tell me a little bit of how dangerous can that be to put someone to sleep? I mean, and what do you guys use to do it?
Well, I'm not going to go over the medications with you because we don't want anybody making cocktails at home.
Yeah, why don't you just tell us how to make it at home? And
that's a different program.
Next week.
It's if a patient eats and they throw up, you don't want anything going into their lungs because at that point,
Oh, I see.
their lungs,
Plus, they're laying, they're
that
laying back.
that portion of a lung can collapse and no longer be functional for them. We just don't want that for anybody. At that point, if a patient does throw up, they can just keep throwing up, and next thing you know, 911 can't do anything for them. Yeah, knock on wood, it hasn't happened, and it's just that precaution that everyone takes.
Yeah, because I know they've even said like not even water, like
Not
nothing.
even water.
Nothing.
You don't want your patient to throw up at all. That's the one time you don't want them to throw up.
Got it.
When your patient's sedated, you don't want them to throw up.
Yeah.
It's real important to always go over that. You'd be surprised how many times I've asked a patient, "Did you eat anything this morning?" No. Are you sure? As I'm walking back, how was breakfast? How was your orange juice? Did you have any apple juice? And we're getting ready to push medications. The doctor's got the needle in the catheter, and just ready to go. I had a half a banana. It's like, are you kidding me? Now we got to cancel your appointment, or make them wait a good 4 hours.
Yeah.
4 or 5 hours. It's just really dangerous, and sometimes the patients don't understand how bad it can go. It's really important. Same thing for front office. Front office should always, inform the patients that are being sedated. Yeah. Please don't eat.
What's
there's a long list to go down.
Generalized amount of time that someone is
the safe zone
asleep for getting their wisdom teeth out? What's like about how long are they usually under?
Typically about 45 minutes.
Okay.
And that's from start to finish.
Yeah.
That's from start to finish.
All four. Yeah.
Sometimes 10 teeth.
Yeah.
Depends on the surgeon.
Yeah.
Some doctors, 45 minutes, it's one tooth. Some doctors, 45 minutes is like 5 patients.
Shit, yeah.
It just varies. It varies.
Yeah. It depends how fast they are. So I know we have some cards here, and we got some questions to ask you guys. Well, actually, I think we gave the answers away already.
You gave the answers away, man.
Darn it.
You gave the answers away.
Yeah, we did.
So
well, I did.
I'll give you these cards. Okay.
No, you know what? We can give them away next time.
Yeah, you give them away. Ask them questions. For your next person that comes in.
Yeah.
Just basically put it out there. What did you learn from the last episode? Did you learn anything? Did you take it back to your office and utilize the information you received?
Yeah.
That's a good.
Well, you know what? I'll still put it out there because maybe they forgot. So, first person to name 5 things that are in the emergency kit gets a coffee bean card, and just tag me, and I'll send it out to you.
Yeah, you could DM.
Yeah, make sure and like the page and
get in his box.
Tag about 1,000 assistants. So I'm glad you came out, man.
Oh, thanks for having me. Thanks for having me.
I was excited, dude. When you said yes to me, I was like, dang, I felt like, he said yes. So I was like, cool.
I even wore my red dress.
Well, I know you got your boots on. I always love your boots, dude.
I always got my boots, man. I would have worn my steel toes if I would have, Yeah.
Yeah, those look good, man. I always like your boots.
I just shined them up for you today, too.
I've been wanting to get boots just because I see you in them all the time.
Oh, yeah. I could run in these puppies.
You could?
Oh, yeah.
Oh, man.
I could do at least a good 6 miles.
Cartwheel?
I could do some cartwheels. I could do some jumps. Whatever you want, man. I'll do it in my boots. Just let me roll up my pants.
Yeah. That's cool, man. Well, thanks for coming out. And, stay tuned, you guys. Next week, we're going to come back. So stay tuned, and we'll let you guys know what's going to happen next week. And make sure and follow us on Silly Panda Media, on Vinoholics, and also The Blacksmith on Facebook, Instagram. I'm working on getting my videos on YouTube so you guys can watch the past episodes. But you guys can still watch them on Facebook. But I'm trying to get a YouTube channel going. So.
Oh, check me out on Holy Smokes Instagram.
Oh, that's right. This guy right here, man. Oh man, I wish we would have got you a picture, so you guys can put up a picture of some of his stuff. But
It's okay. I think my Instagram's on right on your page there, so
yeah,
they'll
so
pop it up for us.
yeah. Okay, cool. Yeah. So holy smokes, man, check it out. This guy can smoke a mean meat for sure.
Yeah, soon to come. Sunday Smokes on YouTube too.
All right, man.
Thanks for
Well,
having me.
thanks for watching, you guys. I appreciate it. Have a good night, and we'll see you next week, man. Thank you.
Thank you.
Thanks for coming.